In this video, we're going to show a lower leg multi-layer wrap using Rosedal K as our main component of short stretch bandaging. But as always, we would actually start with a application of lotion just to make sure that the skin is nicely moisturized. And then we're going to use a TG tubular gauze, a stockinette in size 6, which we're going to roll up like a nylon and then kind of like bring it over the toes just to the base of the metatarsal heads. And then we're going to bring this up all the way to the knee. And it's always a good idea to have a little bit of extra here, so at the end of the bandaging we can maybe turn this over and make it into a nice finish here. At this point, I'm going to just make sure that the metatarsal heads are covered and that the stockinette is very nice and smooth on the leg. Before we engage in the next step of the bandaging, which is a toe wrapping, I want to remind everyone of some contraindications for toe wrapping. One is a compromise in the arterial circulation. You can have a slight compromised arterial circulation and maybe bandaging is still okay, but if your ABI is below 0.5, you definitely don't want to wrap the toes. And some of that needs to be checked with a referring physician or maybe a vascular specialist. In other cases, we would see patients with diabetic feet, and when the patient has an insulin-dependent diabetes, you want to make sure that the sensation on the toes is intact and that the patient can give you good feedback about the pressure on the toes. Sometimes we have to abandon the idea of toe wrapping in those patients. And then a general contraindication would be acute infections. So you don't want to do toe bandaging in patients with an acute infection on their toes, with patients who have a vastly compromised arterial circulation or severe diabetes. For all others, we can use a mollalast bandage. And the mollalast bandage that we use is typically a 4 centimeter bandage, and you can use it the way it comes out of the box, but because most of the patient's feet are small and the toes are tiny, we actually roll this bandage in half and use it in half the width that it comes in. I'm going to start with an anchoring turn over the forefoot, and you can see that I'm a little distance away from the toes because I have plenty of this product and I want to get the forefoot covered with this product as well. I'm going to go to the toes. I'm going to start here with the toe that is most to my right, which is a big toe. And unlike with the fingers, here we can go right over the toenail. We don't have to stay at the nail bed. We're going to go to the toenail. We incorporate the toenail into our wrapping and do at least 3 or 4 turns around the big toe until it has nice, consistent coverage. And you shouldn't see much of the skin showing through the bandage. Then you're going to go around the foot and come to the next toe, which would be the second toe. We're going to do the same. We're going to go all the way to the tip of the toe, as long as we have a little bit of skin showing so we can do a capillary refill test later. That's enough. So we're going to go right over the nail, do 3, maybe 2 or 3 turns over the toe, however many you deem necessary. And then we're going to go to the other side, so we have a little bit of a crisscrossing point over the metatarsal heads. Go around the foot. And you may want to pay attention here to spread out the bandaging so it doesn't hit the same exact spot every time. When it does that, it builds up some bulk and it can eventually be a little bit of a pressure point. So I'm going to fan this out here a little bit, even if I have a longer way to go back to the toe. And then I'm going to wrap the third toe with maybe 2, 3 turns, however many you deem necessary. Crisscross over the metatarsal head here, and then I'm going to go to the 4th toe and the same procedure, 2 or 3 turns, making sure that the bandage stays nice and flat. And maybe at this point I want to make sure that you understand not to force the bandage here on the bottom of the toe. Maybe this camera can pick it up here a little bit. You don't want to force the bandage here into that space beneath the toe, because that can really be annoying for the patient. So we want to make sure that the bandage stays nice and smooth around the toe. And then even if I have still product left, I typically don't bandage the pinky toe. It would be a very, very rare exception that we would actually incorporate the pinky toe into our toe bandaging. The pinky toe does not have lymphedema, it doesn't swell, and it doesn't like to be wrapped in its own compartment here. So we're going to just go with the remaining bandages around the forefoot, making sure that it's nice and smooth. And at the end, you can tuck it in a little bit, but make sure that it's nice and smooth, that it doesn't create a pressure point. And then I'm going to feel here on the side, on the outside of the foot, on the medial side of the foot, and make sure that there's no bulk created from that bandage. Now we chose for this demonstration a padding product called Rosedal Soft, and that's like a 10 centimeter wide Rosedal Soft. I'm going to start this right here over the metatarsal heads with one anchoring turn. And the other product that I use for padding is called Comprex Zero. These are little kidney-shaped pieces which eventually go right behind the ankle. And I want to caution you here a little bit, as we incorporate these pieces, we want to bring them more behind instead of below the ankle. Here they can really irritate the patient. It makes the foot very large. And so I want to kind of like make sure that it fits right into that dimple area between the lateral malleoli and the Achilles tendon here. So we're going to incorporate that lateral, and I'm going to do the same on the medial side. But I want to have a good anchor with my Rosedal Soft. Then you see how I'm coming over the arch here. I'm crossing over the tibialis anterior tendon. And I bring that product right to where I need it here over the lower part of the leg. And at this point I can incorporate my lateral kidney piece. I bring this in, stretch the bandage just enough so that kidney piece is staying secure in place. I'm going to go around the medial side, and you see how I'm coming up on the foot again. So as I'm crossing one more time over the tibialis anterior tendon, I'm going to bring it down to the foot, and I'm going to bring it around the foot. And then if there is a little bit of that heel not covered with the Rosedal Soft, don't worry about that at all. That's not a sensitive spot. But at one point I have to incorporate my little Comprex piece here on the medial side. And I'm going to do that now. And here I'm leaning into the limb that I'm bandaging a little bit and bring that Rosedal Soft all the way up to the knee. And in some ways I'm aiming for, I want to say almost like a double layer here of the bandage. Make sure that the very top of the lower leg is covered. Bring it down again and maybe stretch it here to cover the entire lower leg. Now typically I tuck it in and just leave it there tucked in until I reach that point again with my short stretch. When we tape this product, it sometimes tears when you take it off, and the Rosedal Soft can definitely be reused a couple times. So I don't typically tape the end of this bandage. But you see now that the whole foot is covered, except for a very, very, very tiny piece here on the most back heel here. I have my kidney pieces in place, medial and lateral. I have the leg pretty much covered to about 1 finger width below the patella. And then I'm going to start my short stretch bandaging. So for the short stretch bandaging, we use a product called Rosedal K in different sizes. In most adult feet, I will not use the 6 centimeter. It can be used on anybody, even someone with a very large foot. But I find it a little bit easier to start with an 8 centimeter bandage. And we bring that 8 centimeter bandage right over the metatarsal heads. I'm going to do 1 or 2 anchoring turns over the metatarsal heads to get this first short stretch bandage secure in place. I want to make sure that my patient is maintaining about a 90-degree angle. It doesn't have to be precise, but about a 90-degree angle for bandaging will later on reassure that they have good range of motion. And then from here, you kind of like go up and around the lowest part of the leg here. You see where I'm coming out, covering the insertion of the Achilles tendon. That is really important to me. The one thing that you don't want to do is you don't want to bring it up here. First of all, you see how it wrinkles right now. And then if you bring it up here, there's a whole section of the lower leg that is typically not getting enough compression. So I'm going to backtrack here again. After my anchoring turns, I'm going to bring this to the medial side of the foot. Keep it really, really low in the back, covering the insertion point of the Achilles tendon. And now at this point, you can actually pull a little bit here. You can put some traction on this bandage and pull a little bit and see where it wants to go is right back to the distal foot. So we're going to bring this back to the distal aspect of the foot. And at this point, I'm going to follow that pattern, except I'm going to go a little bit more proximal each time. You see that I'm about a half an inch further proximal with this turn. Flex your foot just a touch more, okay? And I'm going to follow this pattern over the foot and around the ankle until we get good coverage on the foot itself. And there will be a point when I'm going to cover the back of the heel. One more time around the lower leg. And now you can see nicely how I went back up a little bit higher each time. And the very last turn with this 8 centimeter is going to cover the heel right here in the middle. So I'm right here over the heel, and I pull this bandage here a little bit. I'm going to lock in that heel, make it nice and secure. And oftentimes I would lean into the patient's leg here a little bit and continue this bandage if there's still some left to the lower leg. So now this is only 1 8 centimeter bandage, and it covers her entire foot and ankle. It's a little bit of a judgment call whether I start this here or I start it lower on the foot. This is a 10 centimeter bandage. If I feel like I need a little reinforcement on the foot, I can easily go onto the foot and do a little reinforcement with one turn. But if I feel that I have decent pressure here and enough pressure around the ankle, then I can actually start this one where the other one left off. I angle it down a little bit. This is now a 10 centimeter Rosedal K. Starting it on the distal end of the lower leg. And what I do is I come around the foot, or in this case the lower leg, and I'm going to bring it down and around. And my next turn is up and around. At this point I can unfasten this here, bring it down and around, and again on the next turn up and around. And if we turn the leg here just a little bit to the camera, then you can actually see that I get this herringbone pattern, which actually makes the bandage stay up a little bit better on the lower leg and lends more pressure. At the end, I want to stop about maybe like 1, maximum 2 finger width low below the popliteal fossa. I'm going to do another turn here, straight around, and then if I still have material left, I'm going to bring it around the leg here. Sometimes when the bandage wants to end in the back, I wouldn't do that because it's hard for people to reach. So what I would do is I would just pinch it here, fold it in a little bit, and secure it with surgical tape in an area which is more easily accessible to the patient. So I'm going to bring this here to an end with 2 or 3 strips of surgical tape. As always, we're going to put a little bit of a tab here, so it's easy for the patient to tease off the tape when the bandage needs to come off. And then at the very end here, you want to do a couple things with your patient. You want to maybe fold this down to make it a nice finished look here of the bandage, but you also want to make sure that you have good capillary refill, and we have that. When you check capillary refill, you want to blanch on each toe, and then when you let go, the blanching should go back to normal color in about 2 or 3 seconds. Then we're going to touch that bandage all the way from the foot to the ankle, all the way up the leg to the knee, and I want to be sure that there's a little bit of a decrease in pressure towards the knee, so we have a gradient pressure. And this would be a very simple short stretch wrap for maybe milder lower extremity lymphedema or a venous insufficiency patient. Now we're going to show you the continuation from the knee all the way to the top of the thigh. This is typically done with the patient standing up, and I want the patient to put weight on this leg, so they would be weight bearing on the leg that is being bandaged, but not hyperextended. So I want to have a few degrees knee flexion. Still the weight is on this leg, and then you want to be near a treatment table or some kind of like sturdy, maybe a sturdy chair, something that the patient can hold on to, particularly if they are not balancing very well on one leg. And so I'm going to wrap the leg from the knee up to the thigh, but I also keep in mind that these are only 2 layers of short stretch right now on her calf, so we may have to go back here and reinforce the lower part a little bit in a standing position. Our padding material, we're going to use the Rosedal Soft. We already applied a TG bandage all the way to the groin. Now, the way I start this Rosedal Soft, there is a wider one, which is 15 centimeters. I'm using here a 10 centimeter. It doesn't matter. Both products are very, very suitable for the continuation to the top. I'm gonna fold it maybe 4 or maybe just shy of 5 inches here. I fold the Rosedal Soft, so I have a double layer right away in the popliteal fossa. I'm gonna put this right over the back of her knee, and then I'm gonna bring it around, hold it in place, and basically now make a transition here from below the knee to the thigh. And we have about, I want to say 50% overlap, so that you have a double layer of the Rosedal Soft. And you probably end up using at least 1.5 rolls here for the thigh. I'm going to finish this right here. I'm going to have her hold this. Going to reach for another piece. I may not need the whole piece, but since we have more than we need, I'm going to start a little bit lower here. I'm going to build up a little bit more padding on the distal thigh. I'm going to bring this up all the way to the top. And then at one point, I want to go all the way to the top of her leg, and I'm going to look at the gluteal crease here, see how far up I can come. Maybe bring it up a little bit higher on the outside, make a little bit of a, diagonal turn here, and then bring it down again. And end it about on the top third of the thigh. Now again, you can have your patient hold it if they have good flexibility and they can hold the bandage and still feel sturdy on their legs. We have a good coverage from below the knee all the way to the gluteal fold here. And now I have an assortment of 10 centimeter and 12 centimeter short stretch bandages. I typically around the knee start with a 10 centimeter. I anchor it below the knee, make sure that I have a nice transition from my lower leg bandage. I'm going to anchor it here, bring it around the knee. Sometimes I crisscross in the back of the knee, bring it to the distal end of the thigh, but then come down one more time in the shape of an X here. on the posterior aspect of the knee. And then I'm going to continue in a spiral fashion, going around the knee itself, bringing it all the way up to the top. And this is my first layer short stretch that connects the lower leg to the thigh. Now hold here if you can. If the patient is unable to hold, you can always, tape it up here. But I have my patient hold it. I'm going to switch to a 12 centimeter bandage. I'm going to start that distally here. Make sure that you have nice, strong, weight on this leg. And I'm going to start this here distal, bring it up. My goal is to do one first layer all the way to the top. And we'll see if we reach the top of the thigh and the gluteal fold here with my short stretch bandage. Angle it up a little bit higher on the lateral side. We want to catch a little bit more of the leg on the lateral side and then bring it down medially again and finish it here where the patient can easily reach it. So now I'm going to tape it here with just 2 strips of tape. And that's my first complete layer to the top. Remember the first one that we did a few minutes ago just reached from below the knee to about mid-thigh. Now we accommodated the thigh with short stretch. And now it's important to go back down to the bottom and start distally to feel the pressure. And what you typically will feel is that you need to have a little bit more pressure here distally now because you have a full leg bandage. Before we only had a knee high. Now we have a full leg bandage. And it is up to you and your judgment if it's like a 10 and a 12 or if it's 2 12 centimeter bandages. That depends a little bit on how much pressure you want to achieve. It depends on the size of the limb. It depends on the presentation of the lymphedema. So a lot of different factors. But I would say for this leg, we got to use a 10 and maybe another 12. Put this one back aside. But start it down here again. If you only focus on the thigh, you end up with a gradient that is not perfect. And I'm going to start with the 10 centimeter and show you a little trick here. At this point, we're only going to use spiral turns. And I'm going to go here from the medial side to the lateral side. But I want to show you some little trick here. When you come around, one hand is always holding the bandage. The other hand will smooth the bandage. So I call this my back hand. If one hand is holding the bandage, the other hand is kind of like ironing it on and make it nice and smooth around the leg. So we're going to bring this around, use the backhand to make sure that we smooth out any wrinkles that there might be from the padding material or from just uneven pressure. Bring this around all the way to the top. Now we don't stop at the knee. I'm going to go straight around the knee and bring it to the top. Unlock your knee a little bit. Unlock, yeah, perfect. And now you see that I actually wrap this in the opposite direction. Can you hold this here a little lower? Yep. When you do a lot of spiral turns, it is a good idea to sometimes change directions. It has to do with the long muscles. If you wrap 5 layers in only one direction, the foot may indeed go out or in depending on what direction you wrap the foot in or the lower leg in. So I think if you have multiple layers, occasionally you should change the direction of your bandaging. And so initially on this one here, we went this way. And an easy way to remember it is if I look at how this ends and I line it up with that, that will be the opposite direction. But we're not going to start it here because there's not much thigh left here. I'm going to bring this back almost like here to the knee, wherever I feel like I need to connect. I'm going to bring this 12 centimeter bandage out. Okay, and bring it around eventually she can let go of that. And I'm going to bring it around. My backhand is constantly smoothing it out, making it nice and smooth. At the end, I'm going to bring it all the way. No, don't raise your heel. Thank you for helping, but no thanks. Okay. And then we're going to just end it here. We're going to make sure that it doesn't end straight in the middle, but here it's almost like anterior medial. Hold this here for a moment. You want to have nice long strips of tape. Don't be stingy with your taping here. It needs to be nice and secure. So 1, 2, and at least 3 long strips of surgical tape to secure the end of the bandage. And then a couple more things. I want to remind my patient to put weight on this leg. Not lock your knee, but unlock and put some weight on this leg. And I'm going to go from distal, from all the way down here, up the leg and do a kind of like a squeeze test and make sure that the pressure is a gradient pressure and that it decreases to the top. And then one thing for comfort, we want to encourage the patient to have enough of that stockinette to bring it down medially here, because on the very end of the thigh, if that is a unilateral leg wrap and the other leg is not wrapped, you don't want to have the short stretch chafing on the other side. That is very annoying to the patient and it's not comfortable. The other thing is you want to instruct the patient that they have 2 layers. Should that ever be too much, they can take off 1 layer and still have a layer underneath that is taped up. Most patients will actually be encouraged to wear the bandaging because they see the decongestion and they feel better with the leg being decongested. So they will be compliant and try to keep the bandages on, but you also have to remember that if it's slipped down for any reason or they don't feel well, that they would actually be allowed to take the bandages off and that they have the cognition to understand that and also the mobility to actually do it. But that's a short stretch bandage with Rosidol K from the toes all the way to the groin.